and we find that there's so much, I find that there's so much miscommunication and a misconception that people actually have regarding arthritis. And I have lived with an arthritic dog now for the last 10 years. He's about 10 years old now. And he is doing really well on treatment. He was diagnosed very young. And I know and I understand the implications for him as a patient living with a disease that we know there's no cure for. And seeing him and understanding the process of what's going on has helped me manage him better as a dog owner. And I think this is sort of aimed at hopefully equipping you as staff that might be getting a lot of queries regarding arthritis. But more than that, also aimed at trying to get more, the word out there more about arthritis and getting people to take action. And that's why I've entitled this talk, Don't Let Them Hurt, because there are many dogs that are in pain that don't need to be in pain. And that's a thing very close to my heart. So if we break it down into a nutshell, and if we had to answer the question, well, what is arthritis? Arthritis denotes inflammation of a joint. So if we distill it really down to that, anything that causes inflammation in the joint will be defined as arthritis. So we have to subclassify it to make it more understandable. And so it's generally subclassified into septic arthritis, which is when we have actual infection into joints, usually bacteria orientated. Autoimmune arthritises, so those are things like your rheumatoid arthritises, where your body is overreacting and actually attacking its own joint. And then you have degenerative joint disease, or what we generally call arthritis. Okay, this is where there is wear and tear of the joint, and it's that wearing and tearing that causes the inflammation, the degeneration. And for this talk, that's what we're going to primarily focus on, is the degeneration that happens over time. So to explain this, I'm going to use the model of this picture, which basically puts a picture on your left hand of your screen should be a picture of a normal joint. And on the right is one that actually has arthritis. So if we look at the normal joint, you can follow the cursor at the top and bottom, these brown sort of spotty areas is the actual bone itself, okay? Overlying the bone is a white area of cartilage. And then between the two bones, we have got fluid, which is called synovial fluid. That fluid is oily, it's tacky, and that is basically a lubricant. It's there to make the bones glide nice and smoothly on top of each other. Then you've got that all encased in a, you can almost see it as a little capsule, which is called the joint capsule. And the joint capsule also has got a lining to it. And all of these structures are affected in their own ways when we start looking at how arthritis comes about and the effects that arthritis has on the actual joint itself. So this now is in a case, for instance, that has got cranial cruciate ligament disease, and the patient has now had some degeneration in the joint as well because of that. And some of the important and the key features to notice is we've got very thickened capsule, and this membrane has responded by being thickened as well. There's a change to the actual synovial fluid, so it becomes less viscous, it becomes a lot more watery, so it actually loses its lubricating properties. Then we have extra bone that can be formed. And very important, probably the most important thing is that we actually have cartilage damage. You can see in areas the cartilage will be eroded. It can get that this piece of cartilage here is very thin, And in some areas, that cartilage might actually break through to the underlying bone. An interesting fact of cartilage, it doesn't have a lot of a lot of nerve endings. So you can almost cut into cartilage without generating a lot of pain. But as soon as you go through the cartilage to the actual joint, the bone surface, as soon as you touch that, that is incredibly painful because bone has a lot of nerve endings. So in that way, as soon as your cartilage is degenerated, as soon as your cartilage is eroded, and cartilage is also interesting in that it takes a very long time to heal and heals very poorly by itself, which means that all of this leads to just this ongoing cycle of inflammation. And that is why we often have this as a disease that just gets worse over time. So our main two causes of arthritis is either wear and tear or an actual deformed joint. So if we look at the joints that are undergoing wear and tear, we would find these in older patients. Think here of your slightly overweight or obese Labrador that's been walking around on his joints that are absolutely fine as a young dog, but over time, he's just been a happy dog. He's been running around like crazy, and you can expect normal wear and tear when he gets to 14, 15 years old. So those joints are normally they're normally formed. They look normal on x-rays initially, but then of course you get this wearing and tearing that is made a lot worse by things like being overweight, certain repetitive exercises, and of course if there were any injuries like cruciate disease or those sort of things. And then this ultimately, that wearing and tearing is what leads to your cartilage damage, which is ultimately what sort of gets this pain cycle going and maintains that quite a lot. Then the other spectrum is where we find that a patient develops with a deformed joint. So we would find this more in our younger dogs and cats, and the abnormal joint, or what we call a dysplasia, has often got genetic underlying associations. So these patients would often, early on in their lives, we are already talking about 6 months, a year, already show severe abnormalities in the way that joints had formed. So you end up with things like hip dysplasia or elbow dysplasia, and that you could also find it post-injury. So a dog that would have, for instance, broken his elbow, and especially if it involves the actual joint surface, you can get that you will then end up with an abnormal joint at a very young age. So you're going to have abnormal wearing of those joints. The cartilage is going to wear abnormally, the cartilage is going to be damaged, and ultimately you have cartilage damage, regardless of which two of these scenarios we find ourselves in. So our signs that we find when we are suspecting, or what would make me think a patient might have arthritis, and these are the things that we want people to start noticing in their pets early on, because the earlier we can intervene, the better for the patient. So if you think of that young Labrador, or even a young German Shepherd, there are surgeries that can be performed at a very young age that could actually help them and decrease the amount of arthritis they're going to have. But if people don't even realize that there's a problem before a year old, it means that we miss our opportunity to help these patients. So any patient that is limping, stiffness from after lying down, or going for a run and coming back and being stiff, or the next day after playing on the beach, all of those things could be related to underlying arthritis. We find dogs, of course, starting to walk slow. They don't want to climb on stairs that they used to. They used to be able to jump on the bed. Now they don't want to anymore. All of those things can be an indication that there is a problem. Cats can have quite dramatic behavioral changes. So you would find cats where they used to lie in certain spots that they don't do anymore. They used to have certain activities that they would do by themselves, rolling on their backs, or that they don't want to do anymore. So those, it's also quite common to see. And then aggression can very, very often lead to, or can very often be as a result of pain. And it's cats specifically as well, but obviously your dogs as well. If they've got very sore hips, as soon as you rub over the hip, they're going to growl, they're going to tell you this is sore, and they might even go as far as biting. You could have patients that have a change in their urination or defecation. So they are struggling to squat properly to actually have a bowel movement, which means they can become constipated. Or you have cats that can't physically get into the litter box anymore because the rim of the litter box is too high. So then they tend to rather urinate next to the litter box than in the litter box itself. Or the cat's starting to spray all over the house because it can't actually climb up the steps anymore to get out the window to go outside. And there's no litter box provided inside. So even a almost obscure change like urinating in a different spot can actually be related to arthritis. Severe cases can, of course, have decreased appetite. And interestingly, pain can often cause an increase in drinking. So you'll find that they're actually drinking a lot more. And then you can get dogs that eventually get completely paralyzed. Literally, their hips give in completely. They can't walk anymore. You often get a lot of muscle wastage, or you can see that the muscles are getting much smaller, and you can see a lot more of the bones coming out, particularly in the hind legs. We find that a lot. Cats stop self-grooming. They actually often get these mats over the area that's very small. We find it in dogs, in cats with back pain as well, that they would stop grooming around that area. And you can get, especially the long-haired cats, can get very matted there. So all of these signs can have a basis, or can have underlying arthritis as a cause. So it's very important that we try and get owners to realize that a patient, when they get older, they're not just old. They're probably sore. That's why they're slow. That's why they're stiff. And old age is not a disease. It's associated with a whole lot of things like arthritis, but there's so much we can do. So we want people to realize that they can actually ask for help, because these patients, it's their way of asking for help by showing these signs. So the diagnosis of arthritis is not based on those clinical signs. Arthritis diagnosis is not based on what you see, how a patient walks or gets up. Yes, it's very likely, but the diagnosis is firstly done by a vet. We start with a physical exam. We check, where is the pain coming from? Is it coming from the hips? Is it muscle? Is it actual joints? We have a look at swelling. All of those things come into play when we're looking for arthritis. And then, of course, you can get this, what's called crepitus. It feels crunchy. Literally, it feels like there's stuff in the joint that there shouldn't be. It should be nice and smooth. Then secondly, we can, of course, do some x-rays. X-rays are very valuable tools for evaluating arthritis. And x-rays, we are trying to see what kind of bony changes have we found or can be found on the joints. So in this picture, it's quite nice. We actually have got two hips here. We've got a hip on the right-hand side that is actually quite normal. You can see it's got a very nice normal anatomy. So we're looking at this ball of the hip that I'm showing here, should be very nicely deeply seated. And if you look at the other side, you can almost see that there's this big gap that's formed here on the inside. And that's an indication that this hip joint is not as well seated as the other one. You can see there's a tiny little bit of bone that's starting to form there. That's the first sign of arthritis already starting there. So this is a very young dog, and already one good hip, one hip that's not that great. So this patient would maybe not be diagnosed with arthritis or degenerative joint disease at this stage, but we can be pretty sure it's going to get there because it's got an underlying abnormal joint. It's going to wear abnormally. It's going to result in cartilage damage. Now, this might be what that dog's going to end up looking like. you'll see that there's a lot of extra bone forming here. There should be a nice little waist up here in the bone. That's all filled up with extra bone. You can see that the bones, you can just see these hips don't look normal. They don't actually align properly. You can see there's sort of changes in the space here between the two bones. All of these pieces of bones up here that's all extra bone that's formed because of arthritis. This dog is very sore. This dog is limping, she's stiff, and she's about 2 years old. So arthritis can be severe even at a young age. And it's important to also note that I have seen hips like this on an X-ray that were not very sore. So we never treat an X-ray, we treat the patient. So examining the patient and taking the X-rays are used together to classify and to have a look at the severity and then design a treatment plan with the owner. Some of the other things we can do joint taps, so we can take some of the fluid, we can have that analyzed. What kind of cells do we see? What does it feel like? Is it normal color? So we're there specifically looking at your other types of arthritis. So if we think it might be autoimmune, or we think it might actually be infectious, and that there's bacteria or pus in there, we can have a look at joint taps. You can, of course, do things like CTs, MRIs, and even arthroscopy. Now, for those that don't know, that's when we actually put a little camera in and we can actually go and look at the joint surfaces. And you would look there for the swelling. You can actually see the cartilage being eroded, and you can see a lot of changes in the joint itself. So those things are there as well. But generally speaking, a good, proper physical exam with X-rays give us a very good idea of what's going on. Now, the reason why I'm quite passionate that the diagnosis needs to be made by a vet is that there are a lot of lookalikes. There are a lot of things that you can think this might just be arthritis. And I don't like the words just be arthritis, because I think arthritis is significant and can be very debilitating. But people have this thing that, oh, it's probably just arthritis, but they miss the idea that there might be cruciate disease, or there might be fractures or breaks. There might be duxies with spinal disease can actually present as if they might have arthritis. You can have joint dislocations. You can have other ligaments that are diseased, like your biceps tendons can get sore. You can have muscle or bone diseases like this picture on the right-hand side. That's actually a dog that came in limping. It looked like arthritis, but we picked up that it had bone cancer. Now, I hope everybody would understand that the treatment for bone cancer is completely different and completely divergent to the treatment of arthritis. And we're going to look at the treatment just now, but just know that it's completely different. The same as a fracture. This dog has got a broken tibia. You cannot think that that is just arthritis. And you can even get nerve pinches and muscle strains. And those patients will not respond as well to our arthritic treatments than they would to others. So it's so important to make sure you've got the right diagnosis so that we can start them on the right treatment. So management of arthritis is multifactorial. And if we really want these patients to do well, we need to do a bit of all of this. So we need to look at their weight. We need to check what sort of diets we can feed them, changing exercise, look at supplements. Where does physiotherapy fit in? Medication is actually just a small part of it. And then we've got some surgical options as well. And again, this management needs to be done under the supervision of a vet, so that we can make sure things are being done safely, and that we can make sure that, that it is actually effective. So, but let's talk about some of these things, because I'm sure you get a lot of questions about this. And I think it's very good that you can at least help guide owners as to the potential solutions to dealing with their arthritic patients. So firstly, I always start with weight management, because we do know that obesity and dogs being overweight is one of the leading causes of pets not being healthy at the moment. And the less they weigh, the less impact we've got on joints that are already painful. And it really is worthwhile trying to get their weight down first. If you ever have a choice between a joint diet and a weight loss diet, and you have to choose between the two, choose the weight loss diet first, and then move to a joint diet. Because weight is probably one of the biggest things that we can change that will make a very quick change within the patient. So we really want them actually thinner than ideal. You almost want someone to come and say, you know, are you feeding your dog? Is it, you don't want their ribs to stick out, but if they stick out a little bit, it's okay. Okay, you want them thin. Every kilogram makes a difference. Every 100 grams for a small dog makes a difference. And then obviously there are specific diets. We really like the diets that will help them to lose weight in a controlled, safe, and effective way. One of my personal favorites is something like metabolic. You can also use the metabolic mobility combinations. Those are also very, very good. But there's a whole host of different ways to get them to lose weight. As long as they lose weight, that is the primary goal. Now, exercise is also something that obviously helps for the weight loss, but what's more important is we want exercise because it actually helps to maintain muscle mass. It maintains the muscles that actually now have to help the joint to be stable and to work better. So if we can moderate but not stop exercise, that's ideal. And moderation also means that we sometimes change it to do the kind of exercise that doesn't hurt. So for instance, if you know the patient is walking for half an hour and he gets back and he's quite stiff, you know you're going too fast, you're going too far, slow it down. If you're used to running, let's rather start walking. If you're busy throwing the ball across a rugby field and suddenly they saw the next day, we know it's too much. Let's rather throw it just a little bit closer. So you either change the type of exercise or you at least change the duration or the intensity of the exercise. But it's very important not to stop exercise. And it really is good to listen to the patient. And if they're stiff, if they're sitting down after a walk, you've gone too far, you've gone too fast, or you did the wrong exercise, find something they can do. Swimming is probably one of the best things they can do because it's low impact. If you are lucky enough to use underwater treadmills or have the ability to get a patient to that, that's amazing. It's got its place. And exercise is really important for these guys as well. And then there are diets that have been made and formulated specifically for joint care. And these diets promote healthy muscle mass. It generally tries to stop them from gaining more weight. And the nice thing is that everything that they need from a supplement point of view is in the diet. You don't have to add anything else. And the diet that has really been shown clinically to have the best results is Hill's JD. Unfortunately, there's not a single other diet, regardless of its claims, that's been shown by clinical trial to have the same effects as JD. If you can use JD, you often do find that you could sometimes get away with less medications. And it really does make a difference to patients if they can afford or at least eat that medication. And then physio, we really advise doing this under a physiotherapist guidance. They would normally look at the whole mobility, joint movement aspects of it. They would monitor for those. They would check which joints are tighter. They've got some really nice fancy equipment where one can do ultrasound and laser to help with inflammation of muscles and joints. So, and it really does help to advise active physiotherapy for patients with arthritis as well. Now, supplements is a very hotly debated topic. So I have divided them into two because there's one group of supplements that we know without a doubt, with absolute certainty, proven in science, makes a difference to virtually every single patient. And those are our omega-3 and our omega-6 fatty acids. they actually prevent the inflammation from being as bad as it would be without them. So it's not a direct anti-inflammatory, it's more a prevention of inflammation. And it's the only thing that's actually been shown to slow it down, to make it not as bad as quickly. And it's included in almost all of the joint diets. But you can supplement it separately if you have to, but you do need to get quite a whack of omega-3 and 6 into a patient. So we are looking at up to 1,000 to 2,000 active ingredients, not 1,000 milligrams of salmon oil. That doesn't mean anything. That's got about 100 milligrams of active. So you do really have to give them enough of the active ingredient. So omega-3, absolutely, if it's not on board, it should be. Then we have a host of other supplements. And I must say they come and go. As the bandwagons are changed, we go through phases where someone finds something with chondroitins, glucosamines. You might have heard of things like MSM. The new big one is collagen. Then there's a phase where turmeric gets on board, then that falls off again. So the reason why these things often come and go is because, in absolute honesty, we are not 100% sure to what extent these do actually help patients. It doesn't mean some patients might not benefit. And there are patients that we know, and I have patients that I know for sure that being on this has made a difference. But unfortunately, and that's the problem with the research, is there is so much individual variation between patients. It is one of those we can try and see if it makes a difference. If you've got to choose between a joint supplement and omega-3, you should be choosing omega-3 every single time. You've got the luxury of both, use both. But none of these things replace medication. And often we find that patients are very early on, when they're starting to limp, they're placed on a joint supplement. They're not placed on omega-3s. And more importantly, they're not actually placed on medication that will help the patient. So it is so important that we, rather than putting them straight onto a joint supplement, start them on a proper treatment schedule, and the joint supplements form part of that if it's indicated. Now, I do want to talk a little bit about pain in general, because I'm very passionate about pain. And I think it helps, it often helps to talk about pain to clients and the way the body deals with pain, because in that way they can understand all the different things we can do, and it helps compliance a lot. So if we look at a dog, for instance, and let's pretend this dog has bumped his toe. How does his brain know that his toe is sore? So the first place is you have the origin of the pain, where he bumped his foot or where someone stood on it. You actually have inflammation that actively starts in that area. That pain goes via a nerve up the back leg and then starts going up the spinal cord and is ultimately terminated in the brain where you perceive the pain. So our medications that we have available can address pain in each one of those specific areas. And this is why an integrated pain management schedule works much better than just self-medicating or grabbing something off the shelf without understanding and implementing a comprehensive pain management schedule. So, generally speaking, we would start as a base, as a foundation, with an anti-inflammatory. Now, there's quite a few of them on the market for dogs. There are some that we can use in cats as well. And the anti-inflammatory primarily works at the site of inflammation. So whether that's the foot, the dog has got arthritis in his hip, it would be in the hip. The dog has elbow issues, it would be in the elbow. It decreases the swelling. It decreases the amount of discomfort generated by the joint itself. And it does, to an extent, help in this initial nerve, that nerve isn't as reactive. But then we have pain modulators that work specifically in nerves. So it's in the nerve and it targets the spine in particular. So it basically means that when the dog feels the pain or perceives the pain in the brain, it doesn't feel it as bad. It's just not as intense. And then on top of that, we still have perception modulators that work in the brain itself. Things like, if you look at your opioids like morphine, they actually work centrally in your brain to a large extent, and they stop you from perceiving the fact that you are sore. So it's important to use all these different ways of treating pain. If we were just going to deal with and use something, for instance, that's active in the brain, we are missing a vital link by not using an anti-inflammatory, because the anti-inflammatory can make the whole thing just so much more bearable and make it so much better. You also find that these medications work in synergy. They work with each other. And by adding more than one, you actually find that you can get away with lower doses of each one, better pain control with a lower risk of side effects. Because the reality is a lot of these patients would spend a very long time, if not their whole lives, on pain medication. So by using a multimodal approach and looking at all the different ways where we can deal with pain, we can actually get these patients very comfortable. Now, we have some other advances as well. So there are some injections that can actually be given in the joint itself. Those injections are aimed at trying to get the cartilage to heal as well as we could possibly get it. So we have things like PRP, where that's where we take some blood and we spin it down and we harvest the fluid part with some platelets. And that has the ability to help the cartilage to regenerate better than what it would do without our aid. So that's definitely a possibility in mild arthritis or early arthritis. We've got some other injections that we can give that almost form a protective layer on top of the joint surface, which means, again, we're almost plugging all those little holes of cartilage, all to try and make these joints more comfortable for the patients. Then we also have things that can change that joint fluid. Remember, the joint fluid, as I mentioned, it lubricates, it keeps it nice and smooth, and it actually can control inflammation to an extent as well. So by giving injections like Pentosan, it's one of the injections that you can actually get, that it changes that joint fluid and makes it more viscous and more oily, which means that it just helps that whole joint function better. So it, in that way, does have some anti-pain effects. And there's many patients that do really well with it. There's also some very interesting new advances that have been released overseas, where we can actually harness the body's own protective mechanisms with injections to stop certain pain responses. So we don't have it available in South Africa yet. Hopefully it will be available soon. And it is said to be really one of the biggest breakthroughs we've had when it comes to pain management. So we are avidly hoping that that would come through quite soon. So when it comes to managing these patients, we really, when it comes to medication, need to make sure not only if the medication is effective, but also make sure that we don't have any side effects. The good news of these anti-inflammatories is they really do have very few side effects. And if the side effects are there, they are, generally speaking, reversible. They're not permanent. They're not life-threatening. We would normally see maybe a bit of nausea, some dogs that might vomit a bit, or some diarrhea. And it means we often just have to change from one anti-inflammatory to another. You do have some patients that just can't tolerate them at all. And then you have to look at all the other ways that we can manage the patient that has arthritis. All of these medications have been tested for long-term use. My dog Mowgli has actually been on Previcox now for about 9.5 years, every day of his life, and he's doing really well. We've got no issues with his organs. And the whole idea that an anti-inflammatory causes renal failure, to be really honest, is very outdated. In a massive overdose, yes, that's the organ that's going to be affected. If you let your dog eat a whole tub of Previcox, or you give him a whole bottle of Metacam, yes, you could actually get acute renal failure. But that is using medication in the wrong way that you get such severe side effects. Generally speaking, it's more just stomach upsets or gastro issues, and we normally just change the medication if need be. Then we really try and set strategic plans and goals, like on this medication, I want to see this. If that doesn't happen, we need to try add this. If that still doesn't get us to where we want to be, we might need to change our approach completely. So there's a lot of backwards forwards initially when we start patients on medication, so that we can make sure that our plans are working and that the owners are seeing the benefits of not only the medication, but the whole management schedule. It doesn't help you try and throw a whole lot of medication at a patient, but as we mentioned, they are still morbidly obese. That patient will never walk as well as if we got the weight down, and then we can probably get away with a very small amount of medication. Then it's quite important to remember as well that we do have surgical options when it comes to arthritis. The ideal is to get these patients in young, and if it's those sort of joints that are formed abnormally, we can actually do some surgeries very early on that can delay or decrease the severity of their arthritis as they get older. But when we've got end-stage disease, and that basically means when those joints are so terrible and the patients are not doing that well on medication and we're doing everything right and they're still struggling, one can definitely look at some of the surgical options. We have got a gold standard, which is joint replacements for the hip, for instance. It's one of the few joints that we can replace on a regular basis almost, and that's done relatively routinely by specialists. The downside with it is that it's very expensive to do, but it can work really well. But as a salvage, as another option, we can actually remove the ball of the hip. I actually saw one of my patients that I had to do this with about 2 weeks ago. We did the op. I saw her this morning. She's weight bearing, she's walking well, and she's definitely in a lot less pain than what she was. So it can be done, and often we do it, and that patient's 2 years old. So we've done this at a very early age, and she's already showing some really good signs. So there are surgical options, and of course, when we deal with arthritis, we do discuss these options with owners, and we do give them all the options so they can make informed decisions. But unfortunately, I think one of the things that we do have to sometimes discuss is that when are we going to say that this is the end of the road? Because the reality is many patients with severe arthritis is often brought to us at the end of the day because we have to put them down because of the arthritis. It can get to the point where, regardless of our management, regardless of how much we do for them, their quality of life deteriorates to the point where they cannot be their happy selves. Yes, I accept a patient even on full treatment that might still be a little bit stiff, might still be, a 10-year-old dog is not going to be a 2-year-old dog. That's a reality. But if they can't get up anymore and they can't move and they can't get to their water bowls or eat properly, then we do sometimes actually have to make a call. And it's sometimes a very difficult discussion to have with an owner, but it's very important, I think, that owners know and feel comfortable with the fact of knowing that sometimes that is where we end up. It's okay to make that call when they feel that it's time, and that we support them through that process. Because that is unfortunately where a lot of our patients do end up. Now, we obviously want to try and make sure that that point is reached much later than what we would have done without any treatment whatsoever. So now the biggest thing is, I know I've talked a lot of detail, and at the end of the day, as a frontliner, what can you do to help these patients? And I think as a vet, being on the side of making the diagnosis and discussing treatments, I think if we look at the number of people I see and the number of people that you are in contact with, if we work together to get the word out and to raise awareness and make people aware of the options that are available for their pets, we can actually have and save so many pets from living in pain. So I very strongly believe in a see something, do something attitude when it comes to this. And if you see or hear about a dog that is limping, or a patient, an owner asking about, I think my dog's a bit stiff, what can I do? The absolute best thing you can do is to ask them to go to a vet and have an assessment done so that we can diagnose it, so we can start these treatment protocols, because we need more people to spread the word that there is stuff that we can do to help. There are so many options that we've now talked about that can make a difference to these patients, and get away from the fact that dogs are just old. He can't jump anymore. The cat doesn't jump on the counter anymore. He's just old. He's not. And the more we can get people to get the word out, the bigger difference we can make to these pets. And then I think sometimes it's so easy just to try and, try this food, try this OTC thing, try this supplement. But we can often delay the patient from actually getting the help they need to really make a difference. And timing is sometimes very important. So the sooner we can get them evaluated, the sooner we can actually get that patient onto a treatment that will actually make a big difference. And then we need everybody involved again to help that patient and to help that owner stay committed to the plan. So when they come to buy the food again, and they did go to a vet, and the dog's now on treatment, is to talk to them about it, support them in their journey of dealing with their pet that's got arthritis. Support them in, how is it going? Oh, is he gaining weight on that diet? Well, what can we do to change the diet? That's your job. That's not necessarily mine. Discuss then what we can do to manage the dog's weight and get the weight down again so that we can get a better outcome again. So all of those things come together. And that's why I say this is a partnership of not just making the diagnosis and treatment. That's my job. But at the end of the day, focusing and supporting that owner through what can be a very difficult journey of that patient's life is so important. And that's where we find that owners feel that we make a difference to them and to their patients, because we are supporting them through that whole process. And that's why I feel that together we can really make a difference to these patients. So just in conclusion, quickly, it's a very common problem. There are sometimes stats of 4 out of 5 senior pets have arthritis. Something like 6 out of 8 cats by the age of 10 can have signs of arthritis in their hips. It's common, and it can have a major impact on their quality of life. These patients are living in pain. It's multifactorial, and it really has got so many treatment options that can actually really be used to improve their quality of life. So we need people to please spread the word, get people to realize their dogs are not just old. And so by working together, we can really get them to live happy and pain-free lives. Okay, so that is my